Hello, my name is Desiree Walker, and I'm representing the organization SHARE. Today, we're going to talk about breast cancer. In the African American community, there is still stigma, and oftentimes you hear the big C. And so we're going to address breast cancer. We're also going to address a few of the myths and misconceptions that we have heard. In addition to that, we're going to have 3 breast cancer survivors share what they wish they knew prior to their breast cancer diagnosis. And in addition to that, we're going to talk about the risk factors. But first, what are some of the myths and misconceptions you've heard about breast cancer?
Hi. One of the myths that I've heard is, are there any herbs out there that can cure breast cancer?
It's actually controversial whether herbs can cure cancer. What I'd like to say is that everything that I share is based on science, it's based on research, and it's evidence-based. And currently, there are no scientific studies done that have indicated that herbs are curative. It is true that many people do take herbs in the hope that it will help them with many of their side effects. But it's important to know that if you are interested in taking herbs, you need to discuss that with your physician because certain herbs can actually cause contraindication. That means, i.e., nullify the effectiveness of the prescribed medication. So I encourage you to have an open conversation with your physician if you'd like to take herbs in order to make sure that they are safe while you're undergoing treatment.
Some people say that if you have breast cancer, you'll know because it'll hurt. Is it true that you need to be screened for breast cancer if you have pain?
Oftentimes, people think that breast cancer causes pain, but it's important to know that it's only in rare cases that breast cancer causes pain. That's why we encourage you to know how your breast looks and feels. Breast self-exams can assist with that. But equally important, you should have a clinical exam, and if appropriate, you should have a cancer screening, which is the mammography.
I've heard that breast cancer runs in people's families. Is breast cancer hereditary?
I'd like to say that only 5 to 10% of the cases or the individuals diagnosed with breast cancer is because it's hereditary. Most people diagnosed do not have a family history of breast cancer. But what's important to note in the African American community, breast cancer is not often discussed. And as a result, many people do not know their family history as it relates to the disease. I've met many individuals, it was not until after they were diagnosed that they found out that some relative had had breast cancer previously. So it's important to have discussions with your elders to find out what your family medical history is so that you can take precautionary steps in terms of surveillance. Let's talk about breast cancer risk. Anything that increases your chance of getting the disease is considered a risk factor. If you have risk factors, you should discuss them with your physician. It's important to know that age is actually the #1 risk factor. As you get older, you're at an increased risk. Also, if you started your menses before the age of 12 or go into menopause after the age of 55, that increases your risk as well. If you've not had any children or you have your first child after the age of 30, that increases your risk for breast cancer. And also, it's important to know your family history. If you have a first-degree relative, that's your parents or your siblings, who have been diagnosed with breast cancer, that will increase your risk for breast cancer too. If you have a personal history of breast cancer or any benign breast conditions, there's an increase also. It's important to know that if you've had radiation therapy while you were in your childhood or adolescence, that increases your risk. If you carry the BRCA1, BRCA1, or BRCA2, BRCA2 gene, you are at an increased risk for breast cancer as well. Also, it's important to know that your diet can impact the risk factor. Obesity can also be a risk factor. We're not saying that you cannot drink alcohol, but the amount of alcohol you drink on a daily basis can increase your risk, and smoking is known to be a risk factor for all cancers.
Hi, my name is Pamela Flood Morrison, and I'm a breast cancer survivor. One thing I wish I knew about breast cancer before being diagnosed, I really wish I knew that there were more than one type of breast cancer out there, as well as knowing a little bit more about my family history regarding breast cancer.
My name is Nidra Doreen Najila, and I'm a breast cancer survivor for the last 18 months. I wish that I had known sooner that you can have breast cancer without pain, and I would have gone to take my mammography much sooner.
Hi, I'm Danielle Doucette. I'm a 21-year breast cancer survivor. There are some side effects I wish I would have knew about before I had breast cancer, such as chemotherapy can cause memory loss, which is better known as chemo brain, and it can last for quite some time. There's also, when you have your lymph nodes removed, there's a possibility that you can have lymphedema. And lymphedema is uncurable, so I have that for the rest of my life. So I wish I knew about those different things. Thank you for listening.